myself Dr. Monika, faculty of Physiotherapy department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please like, share and subscribe the channel. Hello everyone, today I will discuss about the radius bone. This is the radius bone. It is the lateral bone of the forearm and it is homologous with the tibia of it has three parts, upper end, shaft and the lower end. Now side determination of the radius bone. This is the head of the radius bone, dish-shaped head which is directed upward, and lower end expanded with the styloid process. This is the styloid process and it always present on the lateral side, and the medial border is the sharpest border. And also on the lower end there on the posterior surface of the lower end a tubercle is present called dorsal tubercle of the Lister, and it is always present on the posterior side of the lower end. These are the side determination. So this is the right side bone. Now discuss about the features of the radius bone. This is the head which is disc shaped and it is covered with the hyaline cartilage. A superior surface of the head is concave which articulate with the capitulum of the humerus and form elbow joint. Circumference of the head is also articulate. It fits in the socket formed by the radial notch of the ulna and form a joint, superior radio-ulnar joint. After that, this is the neck, a narrow neck, and just below the neck there in the medial side of the bone is the radial tuberosity. The roughest part of the bone is radial tuberosity. Now we will discuss about the shaft of the radius. It has three borders and three surfaces: anterior border, posterior border and the medial border. Anterior border extends from the anterior margin of the radial tuberosity to the styloid process. This is the anterior border, and in the anterior border there is a oblique line present on the upper half. It is called anterior oblique line, and on the posterior surface is the posterior border, and on the upper half of the posterior border is oblique. You can also see the obliqueness of the posterior border, and this is called posterior oblique line. This is the medial border and it is the sharpest border and also called the introsseous border. Now surfaces of the shaft. It has three surfaces: anterior surface, posterior surface and the lateral surface. Anterior surface lies between the anterior border and the medial border, and posterior surface lies between the posterior border and the medial border. And last one is the lateral surface. Lateral surface lies between the anterior border and the posterior border. Now we will discuss about the lower end. The widest part of the bone is the lower end. It has five surfaces: anterior surface, posterior surface, lateral surface, medial surface and the inferior surface. Anterior surface is in the form of thick prominent ridge and the radial artery is palpated here. This is the lateral surface, is extended by the styloid process, and on the medial surface there is a notch present which articulate with the head of the ulna and form inferior radio-ulnar joint. And last one is the inferior surface. This is the triangular in shape. It articulates with the scaphoid and the lunate bone, and the surface participate in the wrist joint.